Vaginal dryness can be really tough and really can affect a woman's life, so many aspects of a woman's life. I mean, believe it or not, vaginal dryness could cause pain when a woman sits or when she exercises or when she urinates, even. It can cause pain during sex. One thing I want to say first off is that vaginal dryness affects a lot of women, maybe even more than you might think. I certainly know this as a doctor, but I also know this because I've done videos on vaginal health, changes that our vagina incurs as we age. And it's amazing to me how many people have commented on that video in particular about vaginal dryness. It's actually what prompted me to make this video. So I'll put the link to that video in the comments in the description. Also DM me if you would like that. But let's talk about vaginal dryness, what causes it, but also some potential solutions. First of all, vaginal dryness doesn't just affect those people who are older. It can affect younger people too. So this really relates to the causes. Let's start with some of the more common causes. And yes, the more common causes affect people who tend to be older. We're talking things like menopause and perimenopause. That's that period sort of before a woman becomes fully menopausal, the absence of a period. You might be saying, well, why does vaginal dryness come as a woman gets older and goes into menopause or perimenopause? Well, a lot of it has to do with estrogen. Estrogen helps our body in so many ways. And as our estrogen levels decrease, as we're going into perimenopause and menopause, it can cause a lot of changes. Estrogen helps keep our vagina sort of supple, helps with elasticity, helps with lubrication, so many things. And so when those estrogen levels drop during perimenopause and menopause symptoms, that's one of the reasons why we experience changes with vaginal dryness, or experience rather vaginal dryness during menopause and perimenopausal symptoms. But that's not the only time in a woman's life when she might get, or you might get, vaginal dryness. There are other times, and you may not have known this. When you're breastfeeding, actually, you can experience vaginal dryness, believe it or not. Also, childbirth. So that sort of childbirth breastfeeding stage can cause vaginal dryness. But it's not necessarily just sort of these particular periods in life. There are other things that can do it. Cigarette smoking. Cigarette smoking is not really good for anything. It's also not good for our vaginas and vaginal lubrication. Smoking cigarettes can contribute to vaginal dryness. But also medications, guys. This is something a lot of people don't think about. Now, as a family doctor, I've had a number of patients, for example, on Accutane. That's the brand name of a medication to treat severe acne. People can get, and I've had patients get, vaginal dryness on this medication for acne. You may not have thought about it. Also, antihistamines. You know how sometimes antihistamines dry us up? Well, they can dry us up down there too. Antihistamines can cause vaginal dryness. Some antidepressant medications as well. The reason why, and I'm going to tell you more medications and other causes, the reason why it's really important to go through these causes is because if you are experiencing vaginal dryness, one of the first things you need to do is to go see your OBGYN, go see your doctor who performs your well woman checks and your woman care. The reason why is because we first want to understand why you are experiencing vaginal dryness. It's important not to assume what it is due to and what it's not due to, because as you can tell, some of the things that I'm mentioning to you as causes of vaginal dryness actually can be reversed. If you have vaginal dryness and it's due to a reversible cause, we want to know that and to be able to fix it, right? And as I mentioned before, yes, many women as we get older experience vaginal dryness because of the changes in estrogen and menopause, perimenopause, but many younger women have it too for different reasons as well, okay? Let's keep going on. There are some medical conditions that can predispose a woman to having vaginal dryness. Diabetes. That's right. Also, a condition called Sjogren's syndrome. That is an autoimmune disease. It means the body is sort of attacking itself. One of the hallmark symptoms of Sjogren's is that women and men who have it have dryness, dry mucous membranes. Their eyes are dry, mouth is dry, etc. Women with Sjogren's can also have vaginal dryness in addition to that. There are also some other situations, cancer treatments. A woman who's undergone cancer treatments could potentially have vaginal dryness. Also, a woman who has had her ovaries removed can also experience vaginal dryness as well, okay? And I would also say that there's some things that we could do to ourselves to contribute to vaginal dryness. So that's things like douching, using scented perfumes, scented lotions, perfumes, soaps, things like that could potentially cause vaginal dryness. Be very careful about that. I'm not an advocate of douching. I don't believe that douching is needed. Okay. So you want to be very careful what you're using in and around your vagina. It could be that something that you're doing or using could be contributing to your vaginal dryness. Okay. So there's a number of potential causes, as I just mentioned, a number of things, which range from, menopause, perimenopause, estrogen, to childbirth, breastfeeding, to medications we're on, to certain behaviors, smoking, things we do to our vagina, cancer treatments. I mean, you name it, the list goes on, and there's other potential causes as well. So the first thing really to understand is that, as I mentioned before, if you have vaginal dryness, you are not alone. Please do not feel like you're alone. This video is to let you know you're not alone, and I learned how not alone women are based on the comments on the other video I did about how the vagina changes with age. So many of you mentioned vaginal dryness. So that's the first thing. Number two, talk to your doctor, because we want to understand why the vaginal dryness is happening, okay? The third step then is, once we have a better idea of why the vaginal dryness is there, it may help with treatments, okay? A lot of you are like, well, okay, so what do I do about it, okay? Because remember, I said before, vaginal dryness contributes to a number of issues in a woman's life, right? It can be painful to exercise, to urinate, to even sit, pain during sex, so many other things. All right, so in terms of treatments, let's talk about the potential treatments. And yes, the treatments are going to be dependent on what the cause is. If the cause to your vaginal dryness is something that you are using in your vagina, soaps or detergents or whatever, okay, it could be simply a matter of not doing those things anymore, okay? If it's dryness due to certain medications, it may be talking to your doctor and seeing if there are alternatives, or seeing what workarounds there may be, in addition to some other options I'm going to give you for treatment as well. So some things that can be done. And I want to sort of give a shout out to Mayo Clinic and also Cleveland Clinic for some of the information that I pulled from their websites about vaginal dryness. I think they have both of those websites have really great comprehensive information on vaginal dryness, very clear and succinct. So I really appreciated how they presented it. Treatments for vaginal dryness, what can you do? Well, there are estrogen creams that can be used in and around the vagina, okay? That's got to be determined by your doctor. That's a doctor's prescription. And not everyone should take this. Not everyone is a candidate to take this. It's not wise for everyone, but for many patients, this may be an option. It's also one of the reasons why I say talk to your doctor, because you may be a candidate for something like an estrogen cream, which might help your vaginal dryness symptoms. There are also other hormonal medications that can do it, okay? And speaking of hormonal medications, did I mention birth control pills can cause vaginal dryness? If I didn't, I don't think I did. If I didn't, that actually is something that can cause vaginal dryness too. I was surprised by that, but it kind of makes sense, okay? So keep that in mind. But on the other side, as we're talking about treatments, there are other potential hormonal medication treatments that may help your symptoms. That's got to be done under doctor supervision. They have to determine if you are a candidate, because there can be risks associated with hormonal medications. But understand that that's a potential possibility for many women. There are vaginal moisturizers. Yeah, there are, okay? Actually, there's things that you can buy over the counter. There are lubricants, there are moisturizers that you can use, which I think are great. That's something that you can sort of, even for the most part, do on your own, so long as your doctor says it's okay, right? To see if that helps with some of your activities of daily living and things like that while you are being worked up for this condition, all right? Some people have, and actually it's interesting, some people wrote in the comments of my other video that they use like a vegetable oil or different types of natural oils to sort of lubricate their vagina. What I would say about this is that's probably not right for everyone, because remember, you can have allergic reactions to different things. And, as a doctor, look, I'm just cautious, because not everybody is created the same way or equally. And what might work for one person may be problematic for someone else. So we have to keep that in mind. But in terms of the vegetable oils and oil, things like that, oil lubricants, we have to keep in mind that oil lubricants can damage condoms, okay? So that's not the way you want to go, especially when it comes to, that's not the way that you want to go if you're also using condoms for birth control measures, STD protection measures, things like that, okay? So you want to keep that in mind. You only want to use water-based lubricants. I would say that the lubricants that are over the counter, it's probably a relatively a good way to go. It's over the counter, so it's approved for over-the-counter use. I still recommend you running things by your doctor, because once again, your vagina could be actually sort of a representative of other things that are going on in your body. You want to know why this is happening. You want to make sure the underlying cause is being addressed, or at least it's known. And then you also want to discuss treatments. Those are just a few treatments, okay, guys? You want, oh, and I would also say, guys, too, the other thing too is when it comes to sexual activity, oftentimes vaginal dryness is very, very tough. But this is where arousal is particularly important, and trying to make sure that you are devoting time and energy into arousal, because that is going to help you. Okay. This is just a 50,000 foot view. It's just a little snapshot. I wanted to come in and talk about this because so many of you ladies chimed in, and I'm so grateful that you did. Please let me know what you think in the comments. Let me know what you do, what you experience, because your comments do help other people. Let me know what you think about the video too. I always actually read the comments because I get a lot of ideas from you, so I appreciate them. Also, share this video with other people if you think they could benefit from it. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on all sorts of health topics. Please like and follow my page on Facebook. Thank you in advance for sending stars. For those of you who do, also I'll respond to you personally. Consider joining my exclusive groups for exclusive content, my subscription groups, Dr. Jen Superstars. On YouTube, please subscribe to my channel. Click the little bell for updates, guys. I love y'all. Okay.